Welcome to On the Beat, everyone. I'm over here with Dr. Robert Phyfer from Brooks Eye Centre. Today we're talking all about cataracts and how do you know if you actually have any. Welcome back to the show, my
Hey,
friend.
how are you?
Always great advice. We love having you here. Okay, cataracts. I align cataracts with a sign of age or aging.
Sometimes, yeah, that's an accurate statement to an
Is it?
extent. To an extent, yeah. If you have too many birthdays, you're gonna have some cataracts.
That's such a nice way of putting it. Too many birthdays. I like that one.
Yeah.
Instead of saying, I'm getting old, I've
That's
had too
right.
many birthdays. All right, so just explain to everyone at home what cataracts are.
So a cataract is when the lens in the eye gets cloudy. So a lot of people get confused on where the lens is. Everybody knows where the colored part of the eye is. That's called the iris. The black hole in the middle, that's your pupil. Right behind that black hole sits a lens. It's a oval-shaped lens. And what that does over time, it gets cloudy, and then you start to have vision blur, glare, halos, and things like that at night.
Right.
Yeah.
I see a lot of people with halos. I just think they're good people.
That's right.
So what you're saying is I've got cataracts.
Yeah. You should come see me.
I should come and see you. Okay, so let's talk a little bit how they're formed. Is it diet and exercise, or is it genetic? Or is it just truly age?
Well, you know, there are congenital cataracts, meaning
Really?
you could be born with cataracts. I've seen a few patients.
Oh, really?
Yeah, you can be born with cataracts. Not all of those need to be treated, though. There is an age-related cataract as well, which comes over time. Typically, the way those develop are from UV light exposure, which is from the sun itself. So we tell a lot of our patients, you know, wear sunglasses outside. Diabetes is a cause of cataracts. Steroid use, if you have an autoimmune condition where your physician has you on steroids, that can actually speed up cataract growth. There's a lot of different things that can cause cataracts, but those right there are probably the most common reasons why we will see someone develop a cataract.
Okay, well, just explain to everyone at home, you did touch on it briefly. What are some of the signs or symptoms if someone's sitting at home watching TV now that may have cataracts?
So
would they be watching us blurry right now?
Yeah, well, the biggest complaint I hear is, gosh, man, I'm driving at night and the headlights are just, I've got all these glares coming off these headlights, or there's halos around lights, or I'm sitting in the dark in a restaurant and I just can't read the menu like I'd want to. I need more light. I need my reading glasses on, and I mean, just a lot going on. You know, and here's a big take-home message too. When we do see someone with cataracts, we'll try to fit them in glasses, but glasses will not help you see any better. It's like, think about a cloudy window.
Yes.
It doesn't matter how hard you can put different glass up there all you want to, or put something in front of it. It's not going to make you see better until you get the cleaning lady to come through and clean that window off.
Right.
Okay, now we can see on the other side of that window. And so we send people out for cataract surgery to clean that window.
Okay, well then how do you know you are the right candidate for cataract surgery?
And that's a talk we have with our patients. So there are guidelines and specifications on who is a good candidate and who is not. So what we do is we screen people for that, and you have to kind of meet a visual acuity limit, and we say, okay, based on your vision alone, you're ready to go out for cataract surgery at this point. At that point, it's an elective surgery, so they can decide whether or not, hey, I'm ready for this, or there's something else going on in my life, I'm really not ready for it. So you don't have to do it, but I tell people, if you're healthy, let's go ahead and get this surgery done.
And if you don't have it done?
Your vision's just going to get worse and worse, but it's not going, we can always do it later.
Right.
We can always do it later, so it's not a surgery we have to do right now. It's, look, if you're bothered by it, let's get it done.
Let's get it done.
Exactly.
Prevention is better.
Yeah.
Very quickly, health insurance cover the surgery?
Medical insurance will cover your cataract surgery typically, yes.
All right, well,
yes.
thank you. If you want to find out more information about this incredible doctor, Dr. Robert Phyfer, there it all is up on the screen. Brooks Eye Centre. He will give you a buzz, let you know what is happening. If you maybe have a little bit of blurry eyes, go and give him a call. Back after this short break.